All right, well, we will go ahead and get started since we are at 2:01. I want to welcome everybody to the 2021 virtual series, Forum on Aging in Rural Oregon. And rather than our traditional in-person event this year, which is typically held in a rural community in the state, we are doing this series as a virtual series monthly, the third Thursday of each month from 2 p.m. until 3 p.m. We are planning to be back in person in Seaside in May of 2022, so we're really looking forward to that. Wanted to take a moment to thank our partners who are making this series possible for you all. Central Oregon Health Council, the Older Adult Behavioral Health Initiative, and Toby. Next slide, please, Lauren, if you would. Just a quick note that Lauren Kraemer, our speaker today, has no conflicts to disclose. And next slide, Lauren. Okay, so before we get started, I want to orient you to the platform. The audio has been muted and the video is turned off for all attendees. Select the ellipsis, which is on the bottom right-hand corner of your screen to populate the chat and the Q&A features. We ask that you please ask session questions in the Q&A and reserve the chat function for the question that I asked at the beginning, as well as for any technical difficulties that you may experience. The presentation slides and the recording will be posted shortly after this session on our website. And we'll also link on the website the slide deck that Lauren has provided. And if you'd like CEU for this session, please complete the survey at the end of the session. And I will post a link to that survey toward the end of the session that you'll be able to click on and provide us some feedback. I'll also send an email in the next day or two, which will include a link to access the slides and the recording, as well as the evaluation link. So with that, I am very pleased to introduce our speaker today. Lauren Kraemer is an associate professor of practice in the College of Public Health and Human Sciences with Oregon State University Extension Service. She has been teaching food preservation and disaster preparedness education courses for over a decade in the Columbia River Gorge and is trained as a community emergency response team volunteer. Lauren directs a statewide community-based strength training program for older adults called Strong People. And she is also part of a team that developed an online course called Preparing for the Cascadia Subduction Zone event, which teaches participants how to prepare for and recover from the pending Cascadia Subduction Zone earthquake. Lauren has also co-developed 6 publications in a series called Survival Basics that covers water, food, sanitation, and hygiene, stress, and preparedness kits available to download on the OSU Extension website. Lauren has a passion for preparedness and seeks to empower others through presentations and hands-on courses like this one. So I am going to pass the ball over to you, Lauren, for the presentation, and the floor is yours. Thank you so much.
All right, thank you so much. Great to know you today. Appreciate you all time out of your busy September afternoon to come to this presentation. While I wish we were in person, it's also pretty nice that you can attend from wherever you are today, and hopefully from the comfort of your space, you'll be able to get outside and take a walk after this. I always like to acknowledge that learning about and talking about disaster preparedness can be a little stressful and sometimes triggering. especially thinking about some of these events where our loved ones can be involved. And so I just want to acknowledge that as we get started, and again, thank you for coming today. I'm going to do my best to make eye contact with you like this as I would if I were in the room with you all, but I have some notes on another screen, so if my eyes are darting around, I'm just trying to make sure I'm staying on track of everything. So as Sarah had requested, I was hoping if we were in person, I'd be able to ask you to share your responses to a couple of things. And one of those is something that you're hoping to learn today. So when you saw the presentation advertised and it piqued your interest and you thought, oh, I want to go to that, what was the thing you were hoping to learn as you attend today? And then normally when I teach disaster preparedness classes in my home extension region in the Columbia River Gorge, I like to ask people what nags at them about disaster preparedness. What's that thing you've been thinking about that you haven't done yet? And my hope is that maybe if it's a small thing, you might feel inspired to take care of that sooner than later. We've all got big things that we worry about too, and sometimes those can be a little more tricky to address. But I hope through this presentation and maybe further conversations you have with family or colleagues that you'll take some more steps to being more prepared. One of the things I also like to emphasize when I give these presentations is using the phrase more prepared. And the reason for that is I often think that if I use just the word prepared, it gives us that sense or connotes that there's some finality to it. And I know all of us fall along a spectrum of preparedness, from maybe being a hardcore prepper to haven't done anything yet. And so my goal when I give presentations is always to help folks move further along that spectrum and ensure that they feel a little bit more prepared, even if it's just with more knowledge and information at the close of our discussion today. So here are a couple of things that I know we'll cover today. One of them, the first one, is why might older adults be a more vulnerable population during disasters? I'm sure those of you who work with or live with or care for older adults have some ideas about that, but I want to cover some other things as well. And then I'd like to go over the 3 steps to preparedness. Those include making a plan, making a kit, and being informed. Those are kind of the 3 main pointers if I were to distill lots and lots of information down to 3 things that hopefully you'll remember. Those are the 3. And then I've also compiled a huge list of hyperlinks and website addresses and some other of those survival basics publications that I've helped to develop with some other OSU colleagues. And Sarah will drop that link in the chat, I believe was what we talked about. So those will be available for you by the end of the presentation. And there's, probably 25 links. So our hope was that you could take some time to explore those at your leisure and with your own interests sort of guiding you along the way. So why are older adults more vulnerable during disasters? One of the things I want to clarify is that advanced age in and of itself does not make a person more vulnerable. As we all know, aging is another spectrum. And so if we were to conjure in our minds an older adult, maybe it's a 70-year-old man who lives alone independently, still very active, he's going to have a lot of skills and assets and vulnerabilities that are unique to him as compared to a 70-year-old man who lives in a skilled nursing facility who needs a lot of support. So as the adage says, age is just a number, but a lot of us are going to have unique and different circumstances. So I'd like you to think, as we're talking about this, about an older adult that you can picture in your mind, and how might that person respond when there's an evacuation order or a power outage or an emergency alert pops up on their cell phone? What is going to be their reaction? Perhaps it's a loud knock on the door by someone asking them to evacuate right away and telling them they need to leave their home without much notice. So these are the types of situations that older adults may be faced with as a disaster approaches. And I think, as you can imagine, many of them will have very different reactions depending on their age and their abilities and some of their different medical needs. So a couple of statistics here for you to set the stage. By 2050, just not too far off from here, 1 in 5 Americans will be 65 years or older. Older adults are the fastest growing age group in the United States. Research has shown that unfortunately they are the least prepared age group for disasters and have the highest rate of disaster-related deaths during and following disasters. Also, the number of disasters continues to be on the rise. Every year, we set new records for different heat events and fires and costs and storms and hurricanes. So you've probably experienced one or a few of these in your lifetime, and unfortunately, we're just going to keep experiencing those types of disasters in bigger scale and with more dramatic and difficult impacts as a result. Other surveys and research have shown that 2/3 of adults have no emergency plan, something they haven't thought about or talked about yet. And older adults often have medical conditions that can make it really difficult to evacuate. So as we're thinking about this, I want to just share some of the situations that can make disasters more challenging for some older adults, again, acknowledging that age in and of itself is not going to make someone more vulnerable, but with age sometimes comes these factors. And it's kind of a constellation of things that can either occur together or individually. So one is impaired mobility. The person may require the use of a cane or a walker or wheelchair. Diminished sensory awareness, which can result in a slower reaction time or maybe not being able to move as quickly through a situation. The next one is dementia or other cognitive disabilities, which can cause more easily disoriented, and that's especially frightening for older adults if they are having to leave a situation or facility where they're comfortable, or at least they know where things are and they're moved into a shelter or to a new living arrangement. Chronic health conditions, especially any that may require daily medication or oxygen or dialysis, those are going to make older adults in particular especially vulnerable during power outages or mandatory evacuations. Additionally, some older adults have limited social and economic resources, so they may be more isolated or have less money or a fixed income, which can make it very difficult to rebuild or access additional resources for preparedness in the first place, whether that's things like buying extra canned food to keep around or more expensive things like purchasing a generator to have in case of power shortage or power outage, excuse me. Another one that's becoming especially apparent, this is something we've talked about in my local community, is sometimes lower technology use and familiarity. Our region has been using social media and texting to push out emergency alerts, especially a lot this year with heat events and smoke warnings and boil water notices. And so if older adults are either not familiar with that or do not have that type of technology, they're going to be kind of in the dark when it comes to those types of notification systems. So that's something that we as community members or social service providers or agencies and organizations need to think about as we try to give that information in the most accessible way, that we may be creating some gaps as we do that as well. And then more than 50% of older adults have some kind of functional limitation, according to the CDC. And for many of them, this means that they will not be able to evacuate independently. And furthermore, of the folks that have indicated in surveys that they couldn't evacuate independently, 80% acknowledge that they need someone outside of their household to help them evacuate. So an example of that might be an elder couple living together. Maybe one is wheelchair bound and the partner would not be able to assist them in an evacuation. So they would need support from somebody else to help them leave their home. And one thing I like to remember is that physical ability is often temporary, right? So 80% of us will have some form of disability at some point in our life, whether it's a bum knee from a skiing accident or pregnancy disability where you know you're not going to be able to outrun a tsunami or get to an evacuation spot. So I've appreciated when my colleagues remind us that we might consider saying temporarily able-bodied as opposed to having those physical limitations. It's a good reminder that we need to think about our mobility, especially with disasters in mind. So one of the things that I found is a really incredible resource to think about this. And again, it's one of the links that will be included in the document sent out during the presentation, is this white paper that was published last January. It's a partnership between the American Red Cross and the American Academy of Nursing, along with a whole host of other organizational partners across the country. And they developed 25 evidence-based recommendations to improve disaster preparedness. And I really appreciated their model. As a public health person myself, I really like these models to help me visualize kind of how we're thinking about a challenge or a situation. So if you're not familiar with models, this is an ecological framework model where we've got older adults and their caregivers in the center here. And then the blue circles that are concentric outside of that are basically the areas that, sorry, I blocked my screen for myself, are the 6 emergency management domains that have been identified. So moving outside of that circle, we've got our community services and programs that may serve older adults. I know probably all of you are represented in one of these blue circles, or at least a good majority of you. Healthcare professionals and emergency responders, moving out again, care institutions and organizations. And then we've got the impact or ability of policy and legislation to shift and support how older adults and caregivers can prepare for disaster. So an example of that might be changing policy around how frequently older adults can renew prescription medications so that we can have an emergency supply on hand, and allowing Medicare or Medicaid to reimburse that, and at a 90-day supply instead of just a 30-day supply. And then another one is research, and that's along the outer ring, but continuing to do research on prior disasters and then looking at what sorts of programs can help facilitate better preparedness among older adults. And then all those colored blocks around that inner circle are, again, some of those things that make it more difficult for older adults to survive and thrive either before, during, or following a disaster. So I'm going to be sharing a few images and stories. Again, I acknowledge that these can be scary and a little bit triggering, but I also just want to paint some pictures with these vignettes and personal stories. I believe in the power of storytelling to share this message. So these are some things that I've pulled from prior disasters that we've experienced in the United States. So what we're seeing here is a National Guardsman carrying a woman from the Superdome shelter that was set up following Hurricane Katrina. One of the startling and horrific statistics from Hurricane Katrina is more than 75% of those who died following the hurricane were over 60. So the vast majority of deaths were among older adults, and that was due in part to their inability to evacuate. Shelters were supposed to be safe havens for the people that evacuated, but many describe them as squalid and lawless, and many adults struggle to be in a shelter because of noise and accessibility, kind of imagining the volume and the cacophony of noise in a shelter environment, as well as low-slung cots and dietary patterns and meals that may not meet what they need if they're diabetic or on a low-sodium diet. A lot of emergency foods, unfortunately, are quite high in sodium, so we have some issues there. The next one here, you may have seen this image a couple of years ago. It became pretty famous, unfortunately. This is a photo of 2 residents at the La Vida Bella Assisted Living Facility in Dickinson, Texas. They have floodwaters all the way up to their armpits following Hurricane Harvey. And this kind of illustrates for me that at least 80% of older adults have a chronic condition requiring medication or medical equipment. We've got this woman in the foreground needing the use of a walker. They're in an assisted living facility, again, to receive that assistance and facilitate helping them to continue to thrive in their environment. And thanks to the marvels of modern medicine, we're able to keep people pretty active and going throughout the older years of their life. But it can mean that people need a well thought out emergency plan to accommodate those needs as they get older. Right here, we're seeing last summer, 200 evacuees waiting outside the Veterans Memorial Building in Santa Rosa, California at 3 in the morning. They were evacuating from the glass fire there, and unfortunately they were ultimately turned away from that shelter because it had filled up, and they were trying to manage COVID along with evacuation. And again, many shelters are not set up to meet the functional needs of older adults, whether that's their mobility or other types of medical equipment needs, along with, just like we talked before, sound and food and the height of cots and those sorts of things. Here's another image, this one of residents fleeing retirement communities under evacuation orders, also headed to the Veterans Memorial Building with less capacity. Many of these evacuation centers filled up early because of the pandemic. And this to me highlights that elders who no longer drive or do not own a car or have access to a vehicle face some significant difficulties in evacuating and may rely on the support of other systems within the local community to support them in fleeing if they need to. Here's one from Salem, Oregon last year. Many of you will recall our horrific Labor Day fires. Pictured here is Patricia Fouts with her dog and some other residents who were evacuated from a senior living home to the Oregon State Fairgrounds. And one of the main reasons cited that older adults do not evacuate is because they are terrified of leaving their pets behind. So that's one of the things that disaster planning needs to address, is making sure that older adults who have companion animals are able to bring them along or have another shelter option for those pets so that they don't put their own lives on the line to stay behind with their animals. Additionally, older adults who are hard of hearing or cognitively impaired may have trouble understanding the information that is shared about disasters or following directions. It can be easy to get more overwhelmed if we're not understanding things. And one of the things we all need to keep in mind as we develop messaging around disaster preparedness and education is to keep things as simple and as plain language and consistent as possible. Kind of the benchmark for that is no more than a 6th grade reading level, because when we're stressed out and worried and overwhelmed, it's not a great time for us cognitively, any of us, to function with really difficult words or instructions. I remember at the start of COVID feeling that way myself, and words now that we understand quite well, like social distancing, felt really complex. Like, what does that mean? And what are we talking about when we use new phrases? So we want to be really clear and simple with our communication and make sure that our agencies and our interdisciplinary teams are communicating well so that we don't have different information going out about the best ways to deal with heat stress, for example. And then this is from a heat wave. I actually have the date wrong. This was this summer. A paramedic treating a man experiencing heat exposure in Salem. Devastatingly, most of the people who perished in our record-breaking heat wave were older adults. So I've got the statistics here. They were mostly older white males and socially isolated. So to me, this gives us an important bit of background around how we can do better and where we need to do better for emergency and disaster preparedness in our communities and across the state. All right, thanks for watching through those. I am going to talk now just about the types of disasters we can expect in Oregon. As I said earlier, many of us and you all have lived through them already, and it can be stressful thinking back to those. But this will help us to think about as we're preparing the older adults that we, again, live, work, play, care for. about the types of things that we need to think about as we're creating preparedness kits or plans. So of course, this will come as no surprise. We need to be prepared for wildfires just about everywhere in our state, as it turns out. I know most of us thought a wildfire on the coast would be impossible, but the wildfires in Lincoln County proved otherwise last year. Along with wildfire comes smoke and poor air quality. This image with the map of cities around the state kind of highlights from 1985 all the way into 2020, the different poor air quality events and days. And as you can see, there really wasn't much going on up until about 2010. And then we start to see some pretty significant spikes of poor air quality. And unfortunately, the expectation is that that will just continue to happen. And so we need to have management strategies for helping folks with breathing conditions or asthma or people who struggle with breathing already to have access to places or personal protective equipment to keep them safe from smoke. Additionally, our evacuation and infrastructure to move from one place to another when emergencies or disasters are bearing down on us has challenges. This is a picture of I-5 as people are evacuating various fires across the state last year. This one indicates our risk of ice storms. This is a picture in the Columbia River Gorge where I call home, where we've got sheets of ice throughout the gorge, which make our roads locally impassable, sometimes for days at a time. And if you're in the gorge like me, you know that we'll get cut off from deliveries and resupplies and things all the time. And so we've got to learn to be more resilient with that. And there are other regions of the state that have similar situations, one road in, one road out, or really rely on a major freeway that can shut down from time to time. And then as Sarah mentioned in the intro, we also know earthquakes are a big issue in Oregon. This map always gives me a little pause to chuckle because it shows that Minnesota might be a great place to relocate if earthquakes are an area of concern, although they do have winter for quite a lot of the year. But my colleagues and I have been working on a Cascadia subduction zone preparedness course. It's broken into several modules, and just as of last Friday is now available in Spanish as well. It's a free course and it guides both community members and organizational employees and leaders like yourselves through a variety of steps to prepare for earthquakes. And we've got a whole host of assistive literature to walk you through those as well, including how to get your food ready, how to prepare water, how to cook without power, and we've got some forthcoming on sanitation and hygiene, as well as putting kits together. So with all that said, emergency managers in Oregon are encouraging us Oregonians to be at least 2 weeks ready. Not to go against what they're saying or be inconsistent, as I've just warned us all not to, but I think we all know based on some previous disasters and impacts on rural communities that 4 to 6 weeks might be a little bit better. If you picture any emergency or disaster that's happened across the country, it is rare that they are able to respond with any sort of immediacy. It usually takes at least a minimum of a couple of days to a week for FEMA and other federal agencies to get organized and figure out where support and supplies will be mobilized. And so personal preparedness is really key. And that's not to substitute the tremendous support that we will ultimately receive when we have disasters, but there's really no substitute for being personally prepared or having your household or your neighborhood prepared. And so now we're going to go into that level of preparedness. How do we make a plan? How do we build a kit? And how do we get more informed? So step number one is making a plan. This is something that I encourage all folks to discuss and plan with their family or their caregivers. Older adults really need a personalized emergency plan listing where they can go in an emergency, what they need to bring with them. That can be medications, eyeglasses, hearing aids, all those assistive technologies, oxygen, how they will get there. And these are things that should be discussed and planned with family on a regular basis. Perhaps updating it once per year or more frequently. I think it's also important to ensure that if there is a support or service animal involved, that we think through that with the plan, and make sure that multiple members of the family are involved with that planning, or caregivers, whether those are paid or unpaid caregivers. We also recommend that folks think through, sorry, lost my train of thought for 1 second, through if an evacuation was necessary, where folks would go. So that's something we'll talk about a little bit more here. So one of the other important things within that plan is knowing how to communicate. So if you've ever been in a local disaster or an area that has been affected by an emergency, you'll know that all the cell phone lines and phone lines jam up nearly immediately. So that is one reason why emergency managers and planners recommend having an out-of-state contact. And so that's somebody without a local Oregon area code. So we don't want your emergency contact to be a 541 or a 503 number. You want to find that great aunt or somebody that is east of the Mississippi, ideally, and that can be that out-of-state contact where everyone checks in with them. And one other thing to note, if you've ever tried to send a video on your cell phone or a set of photos, you know that it can take a while. You have that blue loading bar that takes forever to go through. So what works a lot quicker and uses a lot less bandwidth is really simple short text messages. So the one that we suggest is just, I'm okay. And it can be all strung together like that. Looks a little bit like I'm a muck, but I'm okay is what we basically want to tell that out-of-state contact if you are okay. And that's something that can be fairly simple to help train and teach older adults to do as well, just to send that text message to their granddaughter at college and say, I'm okay. And maybe she's the one, if she's east of the Mississippi, that can be the connector to other relatives across the state, especially if everybody else is living in that local zip code, or excuse me, area code. Oh, sorry, I want to mention one more thing with this is that most of us have all of those phone numbers pre-programmed into our cell phone, but I do recommend writing down somewhere those top 5 numbers that you want to have, because 1, memory fails us pretty easily when we're stressed out and anxious, and 2, if we don't have our cell phone all the way charged up, then we're not going to be able to access those phone numbers. So in a perfect world, we would have those written down in a couple of places, maybe in our go bag, on a piece of paper in our wallet, and on the wall somewhere near the landline telephone or where you charge your phones, because we all know it's going to happen when everybody's cell phone is on the red with 2% battery left. So you want to have those numbers written down where you can access them later on. The next one is knowing our escape and evacuation routes based on our abilities. So this could be identifying a couple of escape routes out of your community or your home or your neighborhood. A couple of years ago, we had a oil train derail in Mosier, and it shut down I-84 for a full day. And my husband was working 20 miles away from our home in Hood River in the Dalles. And lucky for us, he was aware of some back roads and had a map that was an actual paper map that he could follow and get home safely. And he thought, well, I might be the only one that knows about this route. But as probably you can guess, there were hundreds of cars in that same line kind of working their way over the back roads from the Mosier area, the Dalles to Mosier to Hood River. So having some knowledge of those escape routes and back roads can be really helpful in order to get to that safe place where you need to be. One recommendation is to pick 2 spots. So one maybe just outside the home or care facility where you will meet, and the other might be, let's say you were at work and home needed to be evacuated. Where is the meeting place outside of your home or neighborhood where you suggest meeting? And those are things that ideally you would agree upon ahead of time so that you and your family would all know where to go. And those should be things that care facilities also talk about and practice. And again, for evacuation, we want to know and recognize early warning signals, be familiar with those things, knowing where you might get that information. about evacuation plans and where to go, whether that's in your building or workplace or in your home or neighborhood. As I mentioned before, having an actual paper map is really helpful. Many of us now have gotten used to the maps on our small little screens that guide us and tell us exactly where to turn. But again, in the event that we don't have power for our phones or are unable to use the internet to get those maps to load and those directions to load, and Siri's not there for us, we want to have an actual paper map of our, ideally our smaller community, but also the full state or wherever it is that you are, so that you can navigate those roads. I think it's also important to understand, if you are at the coast, you see that middle photo there, the tsunami evacuation routes are now well posted and identified across the entirety of the Oregon coast. And so my favorite thing to do when we get to the coast from the gorge is to just know where those evacuation routes are. And that speaks to my next point. If you're in person, I'd ask for a show of hands on how many of you have ever been on a cruise. And usually quite a few hands go up. If you've not been on a cruise, I'll tell you that one of the very, very first things that they do when you pull away from port is do a muster drill. And so alarms sound and they tell everybody to report to their muster stations, and you are to grab your life vest. And in your room, it tells you exactly which muster station you need to report to. And the muster stations are paired up with life rafts, and you hear from the crew where you would go and what you would do. And then when it's all done, they say, good job, and you go back to your room and you put your life jacket away and you can go on drinking cocktails. But the idea is that you practice it and you've done it once. And when you get on a cruise, you never, ever, ever imagine or intend that that cruise ship is going to have an emergency like that would require you to report to your muster station and board a life raft. But having gone through it once really helps, because it's created just a little bit of muscle memory so that you're not surprised and you know exactly what to do if that happens. And so something that we do in our household is kind of little mini muster drills whenever we're in a new spot. So we look around, we find our nearest exit, we talk about what some of the risks are, and then we figure out where we would go or what we would do in an emergency. And I would really encourage all folks to do that, to do a little mental muster whenever you're in a new place. Look around, what are the features of that environment, what risks might there be, and what would you do during an emergency or a disaster? All right, so now we're going to move on to making a kit. So some of the things that we need to consider are food, water, and waste. And then I've also added medical. A lot of times when I'm giving general presentations about disaster preparedness, I know that there are a zillion topics to cover and to talk about and think through. I will often focus just on food, water, and waste, but because we're speaking specifically to older adults and their caregivers today, I also, of course, want to add medical concerns. And that's not to say it wouldn't be true for the general audience as well, but I especially want to make sure we talk about that today. So the average person is going to need 1,500 to 2,000 calories per person a day. The aftermath of a disaster is not a time to go on a diet or to try to conserve calories. We want to think through how we could still feel nourished and well fed and energized in order to stay as normal as we possibly can. Water, we need to think through at least 1 gallon per person per day. And I would say that's a minimum, and that is to cover all of our hydration needs, our sanitation needs, and a sponge bath here and there to try to stay clean. Assuming we're eating and drinking like normally, the next concern is going to be our waste management. For some disasters, waste management infrastructure isn't damaged, but if we're thinking about earthquakes or floods or other types of things, there may be a period of days or weeks or months or even longer where waste management infrastructure is damaged and not usable. And so lastly, we want to think through medications and medical equipment. I also like to encourage people to think through where might you have some of these items already. Again, if we are in person, I'd ask for you to volunteer some of those places, and a lot of times what comes up is in the cupboards, in the fridge, in the garden, in the freezer, at the food pantry, at a friend's house. My friend has chickens and we could share, and I have a apple tree and I'd share that in exchange for chicken eggs. So thinking through, this isn't necessarily an entire safe room in your basement filled with supplies, but you've got a lot of this already. And I would guess that for many of us, there might be several days to even a week's worth of food in our homes. We might have to get a little creative. We might run out of fresh things after a few days. But we do want to begin to strategically add to those. So like I said a few slides ago, we work up to that 4 to 6 weeks of preparedness. And there are a couple of ways to go about that. I've got a few images here that kind of go across the spectrum of how people might think through this. So one of the things is just stocking up anytime there's a sale, getting an extra can every time you go to the grocery store, encouraging people to think through some of those bulk sales or buying in bulk if they can to get a few extra things every time they shop, or once a month, that's the buy some extra for the disaster kit. Another way that these items can be stored is all together in a big kit in a garbage can, and that's going to keep it safe from shaking as well as flood damage. You can see that cross section there of just a regular Rubbermaid garbage can with heavy water in the bottom and some canned goods and a first aid kit, an emergency set of clothing and some other things. So that's a way that those could be stored, maybe out in the garage or some other location where they can be easily accessed. And then another way is thinking through, some companies will put together huge serving sizes of dehydrated food in kits like you see here with this emergency food supply. And so there are, of course, pros and cons to all of these options, but these types of kits promise a 30-year storage life and up to 50 or 200 servings, depending on what type of food is in those containers. And so that's another option as well. And those can be, for some people that just want to have it done, fix it and forget it, it might be the perfect choice. For others that want to do it on a budget or need to think through just a little bit at a time, maybe it's this far image on the left that you can see things here and there. I think one of the important things we want to think through anytime we're putting kits together is that storage life? And also, is it foods that you normally eat? You could certainly put together a food supply kit that just had 200 MREs in it, but if you're not used to eating MREs, meals ready to eat, that's going to be a huge dietary shift for you and elder loved ones, and so that may not be the best choice. So maybe a variety of things is going to be the type of thing that gets you ready and moving along that spectrum. If we fail to do that type of preparedness ahead of time, we end up facing situations like this, where we've got empty shelves or shelves that have toppled all their ingredients and it is no longer possible to find the things that you would have liked to purchase. In my particular region out in the Columbia River Gorge, 98% of the food that we eat here is shipped in from other areas. So if we have a road closure with an ice storm or a train derailment or who knows what, we run out of food in our grocery stores in about 3 days. And that is pretty typical across any region. Most grocery stores only stock about 3 days worth of food. The same is true for food pantries and in many cases food banks, because our food system is very much just in time. So that's another thing that we need to consider as we're putting these kits together, is not thinking, well, I'm going to run out to the grocery store before that big winter storm. Though a lot of us do that. We saw pretty quickly with toilet paper and COVID that things ran out and got a little sketchy. The next one here is water. So we talked about having a gallon per person per day. Again, using that theme of 2 weeks ready at a minimum, that would be 14 gallons. A couple of years ago, OPB did a series called Unprepared, and they were looking at all the ways we could help Oregonians get more prepared. And so they did a photo challenge called the 14 Gallons Challenge. So you can see here all the ways that people put 14 gallons of water together. Many of us are not going to have the ability to have giant 50-gallon drums of water stashed in our homes. So I want folks to think creatively about how that might work. Maybe it's something like putting a bed on razors elevated bed is what I mean, and then storing some cases of bottled water underneath the bed, or putting 3 cases all stacked together in the foot of a closet where they're easily accessible if needed. Ideally, we want to refresh that water here and there, feed it to the garden plants, and then refill these big jugs like you see here. In our house, we have the big 7-gallon containers, and I've slowly, usually once per year, added a new one to our stash. For our household, we get a little more prepared a little at a time, and I find for us that's the most manageable way to do it. Little pieces each time. In fact, every time I give one of these presentations, I myself try to do one more thing to get a little more prepared. This year, that was getting a foot pump hand washing station for our house that we can use for both camping and for emergencies or disasters if needed. So I would invite you to think about the people that you care for. If you are attending as an organizational person who provides care for folks, this is a really critical thing. Many of us cannot survive more than 3 days without water. And in fact, many of us would feel more comfortable if we had water sooner than that. So thinking through how you will have enough water for your clients and patients, whether again, that's big jugs or 50-gallon drums someplace, and then for the home or community neighborhood setting, thinking about how you might store water in other creative places. Back to that question, where do we have some of this already? Thinking through ice cubes and gallon jugs of water that you might have in the freezer somewhere, or things like the water heater that you could pull some water off of, assuming it was not contaminated. So those are, yeah, I'm seeing some of those comments coming through in the chat. Thank you. It's hard to monitor that with a couple of screens here, but thanks for those of you sharing some great pointers. And then I mentioned waste management. So there's an excellent organization in Oregon, RDPO, the Regional Disaster Preparedness Organization, that's put together these awesome stickers, pee and poop labels. And so these are items that you can download and affix to your own buckets that you've got at home. We have some set in our home down in the basement. And this is really important because if we cannot keep our waste managed properly, then we run the risk of having secondary outbreaks of disease or unsafe food, unsafe water if we're mixing our waste with things that we're trying to eat or drink. So I highly, highly encourage homes and even bigger facilities to think about this. How are we going to manage waste? In this situation with the 2-bucket or twin bucket system, pee and poop are separated, and that allows us to more easily discard of fairly sterile urine, can just be dumped outside in the garden or watered down and then dumped outside. Poop, of course, needs to be handled much more safely. So a bucket for poop is going to be double lined, and then we are adding some type of carbon material to the top to help it dry out. And then that has to be stored someplace safely until waste management and sanitation is back online. So I know I'm just barely touching on some of these things again. There'll be some more links to get more and additional helpful information and explanation of these kits on that set of links that will be sent out. Again, with kits, they should be living kits and thinking through the things that you need. We talked again about that 2 weeks ready, but I also want you to think about the places where you might also spend time. So a lot of us are working from home right now, but as we go back to the office or go into our work sites or think about other locations where we do spend a significant amount of our day, we should have kits available in those places as well. So that might be a backpack in the back of your car or under your desk at work. And those are going to be filled ideally with items that can help you survive in that other place until you can get back to your home if you've not had to evacuate your home. And then again, with that idea on medical, I want us to think about, particularly with older adults, how we might mobilize some of these things or think about extra sets of these items or what would be needed if critical infrastructure or utilities were not available. So whether that's a generator for an older adult if they're living alone or still living independently at home, Ideally, we've thought through some of this ahead of time so it does not become a second emergency on top of the first one. Maybe that also means getting a second pair of glasses or keeping the old set around just in case. I mentioned getting an extra supply of medications, and I did some research earlier this week trying to see what does that take to get an extra month or two of medications, and I was told by the pharmacist that I spoke to that that's a conversation with the doctor. The insurance agent that I talked to as well said the same thing. So you might consider either yourself, if you're attending for you personally, or for an older adult, having them talk with their doctor about getting an emergency supply of medications. And for just about any maintenance medication for various chronic conditions, that's allowable. So that's a really important thing. We don't all want to be running to the pharmacy as a disaster is heading our way. So we're going to move next into be informed. This is our last step. And some steps for being more informed are to have a crank radio so we can stay engaged with news announcements, evacuation updates, other things via the radio. As I mentioned before, many emergency managers are now using text alerts, emails, and automatic phone calls. So every county, unfortunately, has a slightly different system. So some folks are using a system called Everbridge, others are using one called Red Alert. So just do a little bit of research for your particular county to make sure that you are up to date on the emergency messaging service that they use so that you can get those messages. And that may mean taking an elder's cell phone, having kids or grandkids help with that, and just signing them up for it on their phone to make sure that they're getting those messages. And then the last one I've got here is social media. Again, a lot of different organizations are now using Facebook and Instagram and Twitter to communicate out important things. I know in our region, we've got a Columbia Gorge Wildfire Preparedness page, so information about local fires and smoke goes out on that. And that sometimes is one of the most up-to-date places to look for that type of information. Another set of steps to being more prepared is knowing where some of these utilities are for your home or your workplace in advance. This is particularly true if you're in a new place or if that older adult has recently moved locations outside of their longtime home. Obviously, smoke detector on there so that we are among the first to hear if there's smoke or fire event in our immediate household. And then just finding where your electric panel, your gas, and your water shutoff are ahead of time, knowing how to turn them off is really important to avoid fires, gas leaks, water leaks, etc., following a major disaster. A couple more speaking specifically about older adults and caregivers is evaluating emergency preparedness among assisted living or skilled nursing facilities. There's a set of questions that I've linked again on that document for what types of questions should you ask if you're an adult child who's considering moving your older parent into an assisted living facility or an independent living facility. There's a great set of questions there to just consider. And I think that's a wonderful practice to get into to make sure that we're all thinking about preparedness. Then I've also got an image here of the complete care plan that's put together by the CDC. And this is something that can be filled out and goes through all the different medical issues, conditions, medications, providers, and can be a part of a person's go bag or their emergency information. Some other things are that we are very likely, we being all of us in our communities and in our households, going to be the first responders to a big emergency. We're going to be the ones that are helping our neighbors and helping one another. So if we have the opportunity to get better prepared through an updated CPR class or first aid class, or I mentioned having a backyard chicken coop or a garden, those are all things that are going to help us be a little more prepared and a little more informed about what we can do to help others during a disaster. And I just want to acknowledge there's lots happening in the chat and I'm not really able to follow any of it. So I'm just about done and we'll have some time for questions. There are some supports for older adults following disaster, of course. So these are examples of ads that have been shared after wildfire this past year. And so some of the benefits of being more prepared obviously are that we have a better sense of well-being and peace and calm about it. Obviously, nobody's fully prepared, as I mentioned at the start of the hour, but we want to do what we can to be as prepared as possible, so that we can reduce our fear and anxiety and all the losses that accompany disasters. I'm going to just share a couple brief bullets on additional opportunities to practice and prepare. So there's a screenshot there with all my links for learning more. September every year is Disaster Preparedness Month, so I always make a point to try to do that one more or two more things this month every year. October 21st, so 10/21 at 10/21 is the Great Oregon Shakeout. This is something to encourage your facility, your family, your neighborhood, or community to participate in. The idea is that at 10/21, you all pretend that there's been a very large earthquake, and so you look around you and see, what would I do? Where would I go? What would my situation be? This year, they are encouraging folks to practice and participate in a 3-day camp-in following that shakeout. So the idea there is that you would essentially pretend that all the utilities are off, no power, no water, no sewer, and you kind of test your kit and see, gosh, where are gaps? How did we do? I'm considering doing this with my little family. I think my 2 boys would get a kick out of it, although they would miss Friday night movie night, but I think it would be good for us to do that type of practice as well. Next year, there's going to be a big event in June, Cascadia Rising, which will be a big practice event with FEMA's Region 10. So I would encourage all of you to talk with your local county emergency managers and public health to see how you might participate in that event. It's a great opportunity to run through earthquake as a drill and see what all the mass care situations and considerations are for that event. I talked about the mental muster. That's something you can do as you are preparing for disasters in any new place. And I also have linked the Just Do One Thing. This is great. There's both a personal and an organizational button you can push from that website where it'll send you like a monthly thing to do. So it breaks it down into just little pieces. And then I've linked our class that we've put together just this past year. So we are used to spending a lot of time preparing for life's big events. I've got pictured here my own wedding, the birth of my child, and then maybe someday planning for retirement. So I hope that each of you will think about how we might spend a similar amount of time preparing for disasters as one of life's big events. We know each of us will experience another disaster at some point in our life. So I hope that we will use the time and effort that we have to think about being more prepared. And I hope also that we'll continue to consider preparedness as a gift we can give to the next generation. This is a picture of me and my oldest child on our first camping trip together. And like many Oregonians who are avid outdoors people, that makes us a little bit more prepared just by knowing we can sleep in the woods without power and water and electricity. And we're learning some great skills. So I know a lot of you probably have some of those skills as well that help us be more prepared. All right, so I know I didn't leave a whole lot of time. I'm happy to stick on a little bit longer. I don't know if that's allowed, but I'm going to stop sharing and maybe we can get caught up on what's happened in the chat. And if there's any questions, looks like I can open the Q&A.
Thank you so much, Lauren. And I just want to remind folks that I did post the link to the resources that Lauren put together for us in the chat. We'll also send that out along with the recording and the slides after today's event. So please go ahead if you do have questions. We can spend a couple of extra minutes for those who want to stick around for questions. Go ahead and use the Q&A box in the chat. And while we wait for some questions to come in, I'm going to also post the survey for this event in the chat for folks who need to take off. The survey is also required if you want CEUs for this event. There's an area for you to say that you'd like those CEUs, and the certificates will be sent out in mid-October. So I'm just going to take a moment and post that survey. before we get to questions here.
I
Oh,
do see one from Leah. I was able to pull a few things out of the chat. So to clarify, the area code is the most important, not the geographic location. So in answer to that, Leah, yes, the area code seems to matter the most. A couple of years ago, there was a bridge failure in Minnesota. My husband and I were both in Oregon, but he still maintained a 651 Minnesota zip code, and I was unable to reach him the whole day, even though he was in Oregon, he still had that 651 area code. So it is important to have somebody with an area code that's not in our state.
and Lauren, there was another question that came in for how do you recommend preparing older adults for disaster preparedness when you have limited clinical time with them?
Yeah, I love that question. That's a great thing. I think, and I was talking with some physician and provider friends of mine, like, is this something you bring up with your patients? Do you get training in it? And largely it was like, we don't have time for that. So I think some of it is trying to break it down in as simple of terms as possible. So maybe if you're seeing them on a somewhat regular basis, talking about, hey, I'd really like us to consider getting prescriptions, at least having that emergency supply. That's something within your wheelhouse, absolutely. And then thinking about, these medications work best when they're paired with a good amount of food and water. So what are we thinking about for disaster preparedness? Unfortunately, disasters are on top of mind for folks as they're happening, which makes it hard for providers because they're also managing that disaster. But I would say any education we can push out during and following fires or smoke events or ice storms, people are really perked up to that type of information at that point. So if you have ways to communicate with patients about those things, I think that's a good time to do it. And then if possible, maybe having them participate with not higher education, but continuing education around it, whether that's the do one thing or some type of handout or something. Those are kind of my 2 cents on the spot right now. Great tips in the chat.
I was on mute. I'm sorry. Another question that had come in was for ideas for presenting this material to students to disseminate during patient education. This was from someone at the nursing school in LeGrand.
So we're trying to disseminate the information to nursing students themselves or to the patients of the nursing students? Just want to make sure
I think the latter.
Okay. I would say probably the best thing is to get some more information and education yourself. So for nursing students, I think it would be awesome if you all participated in the Cascadia Subduction Zone course that Glenda Hyde, Lynette Black, and myself, along with some other colleagues, have put together. It is fairly quick to work your way through, I'd say 5 to 7 hours of class time on the modules. You can do them at your own pace, and that will give you an excellent working understanding of disaster preparedness and education. And that's also broken down by regions across the state. So you can click on the coast or eastern or central and find out some specific information for those areas. And then I think hopefully you all will find the links that I compiled really useful. So those I would say would be great to share with patients. The Survival Basics series are printable PDF documents, so you can keep a collection of those in the clinic and hand them out as handouts and maybe do a big push every September or in October around that shakeout time. So those I think could be some great ways to get more information out. One of them is specifically about how to get prepared, and it's a checklist of steps. And so that one I think is pretty useful because it guides you through a lot of those preparedness steps. And then the accompanying documents kind of give you more details and information about how to get to that prepared level.
And Melissa asks, and I think she's referring perhaps to the Cascadia event, how would I get access to this? Melissa, is that right? Are you referring to the event that Lauren was talking about in her response? Yeah,
Great. Okay.
and it looks like
Yeah.
Glenda put this out there.
Yep. Glenda put it there. Thank you so much, Glenda. Glenda is the mastermind behind the course, and I've gotten to work with her a lot on our project there. So thanks for putting that there, Glenda. So that will guide you straight to the course. You'll register. Again, it's totally free, and you'll be able to just work your way through the different modules. And I hope you'll fill out the evaluation at the end. We're continuing to learn from what our students of that course have to say.
It looks like we have taken care of most of the questions. If there are other questions that do come in, I'll drop my email address in the chat here, and I can make sure that Lauren gets those. And we'll send out the answers to folks when we send out the evaluation link as well. Okay,
Great. Thank you so much, everyone.
Thank you so much. So I want you to know that we thank you very much for being here. The Aging Forum, the virtual Aging Forum, continues online next month on October 21st from 2 to 3. Our presenters, Doctors Carrie Jean Sajoka and Kylan Mateus de Vries, both of Southern Oregon University, are presenting Rural Trans Health in Oregon. So please be on the lookout for our email announcing that upcoming session as well. And Lauren, thank you so much. What a great speaker, great information. We really appreciate you being here today.
Thank you. My pleasure. Happy Preparedness Month, everyone.